Ladies and gentlemen, did you know that in 2017 there were 139 million emergency room visits? The American Dental Association says 1.4% of those visits were dental related. So if we do the math, that would mean that more than 1.9 million visits to the emergency department for that year were related to poor dental health. Today, I'm going to be speaking to you about the need for dental coverage for all Americans as a part of their general health insurance, how poor oral health can contribute to poor general health, how some health conditions can contribute to poor oral health, and the cost savings measures that could be created by including dental coverage in everyone's health insurance plans. For Americans over the age of 35, the number with some amount of tooth decay is more than 150 million. Poor oral health has a direct link to many health conditions. For example, cardiovascular disease. Heart disease and stroke can be linked to inflammation and infections that are linked to oral bacteria. And also pneumonia. Bacteria from the mouth can enter the lungs and cause an infection. These health conditions are preventable. With proper preventative oral health care, the bacteria that is sometimes connected with these conditions could be reduced, making individuals healthier. Sometimes, however, certain health conditions can contribute to poor oral health. Diabetes, for example, lowers the body's resistance to infection and can lead to gum disease in some individuals. Also, osteoporosis can contribute to periodontal bone loss. As you can see from the graphic, almost half of Americans are afflicted with either prediabetes, diabetes, or osteoporosis. The very fact that so much of our health is connected to exclude dental care from health insurance is offensive. As lawmakers, I know it is important to make fiscally sound decisions for your constituents. Preventative oral care is less costly than emergent and extensive dental treatments. Also, citizens who use the emergency room as their primary dental providers in many instances are uninsured, and the reality of this is that a lot of those bills will go unpaid. In a study by the National Institutes of Health of children between 3 and 6 years old in 4 southern states who received sealants and fluoride, dental cavities were lower than for children who did not receive sealants. This created a cost savings of between $5 and $12 million for these states. That is but one small piece of the puzzle that created a significant cost savings for these families as well as the taxpayers of those states. The solution, however, is simple. Dental health should be considered a piece of a person's general health and included in coverage by their health insurance provider. Today I've talked to you about the need for dental coverage for all Americans as a part of their health insurance, how poor oral health can contribute to poor general health, how some health conditions can contribute to poor oral health, and the cost savings that could be created by including dental coverage in everyone's health insurance plans. Every single American with health insurance coverage has the right to be able to afford dental care. The fact that dental health is so interlinked with a person's general health and welfare, it is absurd that people sometimes cannot afford it. In the 21st century, when we could have healthier citizens as well as save money, it is shameful that everyone does not have access to preventative dental health care. Thank you for your time, and I would be more than happy to entertain any questions or comments at this time. Thank you.